Hello everyone, I am Dr. Ragini Agrawal, Obstetrician and Gynecologist. With experience of 35 years in the field of obstetrics, I am sharing my experience with you, which is many a time very incorrect in your mind. The most important thing when you get pregnant is you have to eat for two. No, you are not going to eat for two. You require some extra energy and some extra calories during pregnancy, but it is not about two. We divide pregnancy in 3 trimesters. In first trimester, you don't require any extra energy. In second and third trimester, the outer limit of the extra energy is 300 calories. So you need a nutritious food and calorie-dense food, nutrition-dense food, but not for 2 people. Another thing which I want to discuss with you, the myth is that person should not exercise. But exercise is very important. It will elevate your discomfort, release of a good hormones in your brain, elevate your moods also, and you will have a very good recovery postpartum period. Traveling. A woman should not travel. Yes, she should not travel right and left, but with precautions and consideration which is required, and in this special period you can travel in certain times, but only after discussing with your doctor and taking all care during the pregnancy. Something very important I want to discuss with you, the sexual intimacy with your partner. Should we do or should not we do? That is a very big question. So you can have sexual intimacy, but again, you have to understand your obstetric compulsion, whether you have some obstetric contraindication or not. So this also should be discussed with your healthcare provider, whether you can be intimate with your partner or not. But this period is very important in a way that we don't want you to have any reinfection from your partner. The use of condom is necessary, specifically to prevent herpes-like infections or urinary tract infections, which can cause problem for the baby also. Another thing, during pregnancy, it's a time of bliss, a big 9 months, which is going to affect your whole life till end. People ask that the ultrasound can cause harm to my baby. No. Ultrasound is a sound wave. It is not a radiation like X-ray. So ultrasound cannot cause any problem to baby, but it gives us lots of information to save your baby in time if there is some problem is occurring inside the uterus. Pregnancy does not mean that you become a boorish person. Today, lots of very nice maternity clothes are there. You should look smart, stylish. Yes, there are certain things you should not use, like synthetic clothes, tight clothes, or anything which can cause problem in your body, rashes and all. And one thing is very important, it is better if you wear loose clothes, pure cotton clothes, so there is a air circulation in your body. It will literally release you from lots of vaginal infections, itching and rashes. Another tip for your nutrition, what you eat and what you should not eat. The basic thing is that you should not eat anything which is man-made, because mostly they have lots of stabilizers, preservative and the chemicals. So don't use any tin can thing or anything which has a long shelf life, because ultimately the using lots of chemical can affect the baby. We don't know actually which chemical is going to have an effect on the developing fetus. So use homemade food. If you want to use chutney or any sauce, make at home. Don't take the bottled sauce and chutneys, and not any instant food in the form of Maggies or your cereals. Outside food is very important not to take, because we don't know the hygiene of the food handler. In pregnancy, your immunity is low. You can get infected and have a vomiting diarrhea, although your partner is not affected. Third thing, if you keep your spices fried, things slow in your diet, it will not cause lots of heartburn, nausea and vomiting. So the mantra is simple, home cooked food which is nutritious, almost with the low spices, frequent and in a small amount you can take with lots of hydration and water. There is a myth that all women should experience the morning sickness. No, every woman does not experience morning sickness, and the woman who experiences the morning sickness, it is not something which is going to be continuing the whole pregnancy. It is for a short time. By the end of the first trimester, your morning sickness will go, and it is because of the fetal hormones, and all the time you don't need the medicine, but you have to take care of your food, bland diet, cereal-based diet, no juice, no milk, and consult your doctor to take care of your morning sickness. Thank you so much.